Plantar fasciitis is a condition that causes pain in the heel and bottom of the foot. The plantar fascia is a band of tissue that runs along the bottom of the foot from the heel to the toes. This tissue can become inflamed, causing pain in the heel and bottom of the foot. Plantar fasciitis is a common condition, and it is often seen in runners. Treatment for plantar fasciitis includes rest, ice, and stretching exercises. Surgery is rarely needed. If you have plantar fasciitis, it is important to take breaks when you are active. You should also ice your foot for 20 minutes at a time, several times a day. Ice can help reduce the inflammation and pain. You can also do some stretching exercises to help relieve the pain. If these methods do not work, you may need surgery in Fort Worth, TX. Symptoms of plantar fasciitis include heel pain that is worse in the morning or after activity, pain that increases over time, stiffness in the heel, swelling in the heel. Treatment for plantar fasciitis includes resting. You should take breaks from activities that make your pain worse. Icing. You should ice your foot for 20 minutes at a time, several times a day. Stretching exercises. Heel stretches and calf stretches can help to relieve pain. Ideal candidates for plantar fasciitis treatment include people who are active, such as runners, people who are overweight, people who have a job that requires standing or walking for long periods of time. Types of surgery for plantar fasciitis include release of the plantar fascia. This surgery involves cutting the plantar fascia to release the tension on the tissue. Achilles tendon lengthening. This surgery is done to release the tension on the Achilles tendon. Calcaneal osteotomy. This surgery is done to realign the heel bone. Recovery time for plantar fasciitis after treatment. For most people, recovery takes 4-6 months. You may need to wear a boot or splint for 6-8 weeks after surgery. You will also need physical therapy to help you recover. After surgery, you will need to wear a boot or splint for 6-8 weeks. If you have these symptoms, you should see a doctor. The doctor will ask about your symptoms and may do a physical exam. They may also order X-rays or an MRI to rule out other conditions. If you are interested in receiving plantar fasciitis treatment in Fort Worth, TX, please give our office a call today at 9,728,059,985. This video is for informational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. If you have any concerns or questions about your health, you should always consult with a physician or other healthcare professional.